Today we are going to be talking about acute care chart reviews and military time. Here's a scenario. You're in a hurry and want to go home, so you quickly walk into your patient's room for a treatment session earlier than scheduled at 2 o'clock. You sit them up, get them out of bed, and take them for a walk down the hall. Suddenly, your patient takes a turn for the worse.
Dun, dun, dun!
She starts sweating, asks for a drink, and goes limp on the ground. You give the patient some water, and she starts complaining of her legs hurting. You quickly yell for help, and the nurse runs up to you saying,
What are you doing? She's bed rest only, NPO diabetic, and was supposed to get meds at 1400. The patient was not to have therapy today until 1600.
What is happening? I should have reviewed the chart, and I don't know what 1400 or 1600 is. This is why, folks, we need to learn about chart reviews and military time so this mistake will not happen. So sit back, grab some popcorn, and let's get hyped. Here is an outline of what we will be discussing today. We will be covering what to look for in a chart review, vitals, lab values, what a chart looks like, and military time. So here are some things that you will want to look at right away when you're doing a chart review. So first you're going to want to note the patient's name, the PT orders, the room number of the patient diagnosis, activity level, clearance from all involved disciplines, weight-bearing status and activity restrictions, medications, imaging, and lab values. So first you're going to want to look at the patient's name and look and see if you have the correct patient. Obviously that would be a good thing to note right away. Then you're going to want to know what your PT orders are, so if they match up in the chart. So you're going to want to know if you're going to have eval and treat or just eval only. Another thing that would be very important is room number. You don't want to go in the wrong room. That would be really embarrassing. Patient diagnosis, also another good thing you're going to need to know. That's going to give you a general idea of how your patient will present. Activity level can vary between patients, so you're going to want to know if they have bed rest, ambulation, or activity is tolerated. Obviously, you're not going to want to get someone up if they're supposed to be on bed rest. If it is an involved case, there is going to be clearance from many doctors, so you're going to want to make sure that all doctors have cleared the patient for PT before you start. Weight-bearing status can also vary. There's weight-bearing as tolerated, full weight-bearing. The activity restrictions, there can be activity levels can vary. And then also precautions, so you're going to want to know if they have any precautions from any surgeries or anything. Medication alerts you to any allergies that the patient may have and can warn you of any side effects. You would need to know this during a PT session. Imaging, there's MRI, CT, EKGs, and X-rays, many more. You're going to want to check the recent imaging, see if they have a fracture, if they have a bleed. And then it's helpful if you read the impressions of the imaging to help you get a better idea of the patient. You're also going to want to know if they have any pending imaging that needs to be done. This means that you need to wait to see the patient until later, and PT is not advised at that time. Lab values are also important because they tell you important things about the patient, and we will have more on lab values later. So some other things that you're going to want to check in the chart review are the patient's past medical history, surgery, the impression from the doctor's note, any progress notes, precautions, the nurse's notes, if OT and speech have already worked with them, the social worker, if they're in isolation or not, and their diet. So with past medical history, you're going to want to read what the patient's past medical history is to gain an understanding of what could be contributing to the patient's presentation. So do they have diabetes? Are you going to need to check their blood sugar? Did they have a total knee 3 years ago? Is that going to be a problem when you get them up to walk? So all these things are important to check. Surgery, you're going to want to know if they've had surgery. Are they going to have surgery? How did it go? Do they have precautions from the surgery? Do they have hip precautions, spinal precautions? So you're going to want to know all of that from the surgery. And then reading the impression from the doctor's note will give you a summary of what the doctor is thinking and how the patient is presenting. And then you're going to want to read any updates from other disciplines that will give you progress that you may need to know, such as are the precautions lifted now? We can learn a lot from our nursing staff. They can tell us about pain, any comments about mobility, how their patient is being with compliance. So always good to read the nurse's notes and see what, especially the last one that has worked with the patient. If any other therapy disciplines have worked with them, you can find out information from them as well, such as OT and speech. The social worker will give you information about family support, the patient's insurance plan, and their discharge plan. And then you are going to want to know if your patient is in isolation so you can suit up before you go into the room. Also looking at the patient's diet. Are they NPO? Are you supposed to give them ice or no ice? You don't want to be that person that gives your patient ice when they can't have it, even if it is a sweet old lady who reminds you of your grandma and keeps asking for ice. You don't want to deny your grandma ice, do you? Don't do it if they can't have it. So definitely make sure to checking their diet is important. And as a friendly reminder to always, always, always contact your nurse before going into the patient's room to see if it's okay with them if you go in.
But wait, there's more, because WWSD, what would Stacy do? Stacy would do vitals. Vitals are so important, and do not forget. They're important because they're a key part when you're treating your patient. They may show that the patient's not appropriate for treatment, but they also might show how your patient is handling therapy, especially if they can't verbally tell you how you're doing. You can look at their vitals and kind of see how they're tolerating it. So vitals, you can look at their record for the past couple of days, just because everyone's normal is a little bit off. So the best way to get an idea of their vitals is to look at the past couple of days. One thing you're going to look at is blood pressure. The normal is considered 119 over 79 or lower, and high is considered 140 over 90 or higher. So blood pressure, it's normal for blood pressure to fluctuate throughout the day depending on the time, the foods you eat, exercise, stress, and many other factors. So with a lot of these vitals, you can kind of talk to the nurse and see where you feel comfortable stopping treatment with. So heart rate is another one. Heart rate is the number of heartbeats per minute, or also known as pulse. A patient's heart rate is susceptible to changes in the body's normal state and can change according to your needs. As a vital sign, heart rate can be used to assess the patient's physical and mental state. Normal is usually between 60 and 100 beats per minute. And next would be respiratory rate. So it's the number of breaths per minute. Respiratory rate is an important vital sign to monitor because it's inadequate inflow of oxygen and outflow of carbon dioxide, and that can place a patient at a risk for death or permanent injury. Also, abnormal respiratory rate may also indicate some other disorders such as asthma, sleep apnea, COPD, and anemia. The normal respiratory rate will be anywhere from 12 to 20 breaths per minute. And another one is oxygen saturation, or SpO2. This is the concentration of oxyhemoglobin divided by the sum of concentration of oxyhemoglobin and deoxyhemoglobin in the blood. You want it to be at least 95%. That's normal. So in addition to heart rate, this is a good thing to look at how your patient's cardiovascular system is handling therapy. An oxygen saturation value that is significantly low, such as below 80, can indicate hindered organ function. So that's oxygen, something that you really want to keep track of. So labs, what are they? A lab can be anything from a blood test to a radiograph. If blood test is certain, there's specific values you should look at, but most of the time, if it's too low or too high, or it's an important value that they want you to know, there will be some sort of exclamation mark, red flag, something to draw your attention. And if a radiograph was done, the best thing to do is look at the impression. That is where you will get the most information. So why is it important to review lab values? Because it may hinder the patient's ability to get mobile. It may not be safe for the patient to get mobile, and there may be certain vitals you need to watch close compared to other patients. So some labs that they might do are complete blood counts, electrolytes, and glucose levels. No lab is more important than the other, but these are the ones that you'll commonly see. So a complete blood count, this is a little bit of an example. It provides results regarding the concentration of platelets, white blood cells, and red blood cells. White blood cells identify the presence of inflammation, infection, and allergens. Hemoglobin assesses bone marrow suppression, anemia, and blood loss. Low values may lead to heart failure or death, while high values may lead to clogging of capillaries. Hematocrit assesses blood, fluid balance, and blood loss. Low values may indicate heart failure or death, while high values may lead to spontaneous blood clotting. So you can see in this chart there's a lot of numbers. You don't really need to memorize the normal range numbers. It's just kind of good to know. But like I said, if it's high or low to a certain point where they want you to know, then there will be exclamation parts or something like that. This is a sample of an electrolyte lab value. So sodium values that are too high or too low may lead to impaired cognitive status. Patients are at a higher risk for orthostatic hypotension if the value is too low. Potassium is important for the function of nerve, muscle, and heart cells, and patients may have muscle weakness if they're hyperkalemic. The other electrolytes are just as important, but the two most important ones for physical therapy are probably sodium and potassium.
Hi guys, it's me, Jessica. It's time for a joke. Lydia, do you want to know, or do you know any jokes about sodium?
Nah.
Oh, alright. Then, Anna, do you want to hear a joke about potassium?
Okay.
Wonderful. Ha ha ha! Back to business. So, as you can see, there are a few other labs that you might see on a patient's chart. For example, blood glucose, which may be very pertinent to PT treatment. If the glucose values are too high or too low, a patient may have decreased tolerance to activity. It's important also to monitor vitals if a patient has poorly controlled diabetes, and it's important to educate those patients on the importance of exercise for blood sugar control. Other values that you might see that may also indicate a reduced tolerance to activity might be hematocrit or hemoglobin levels. So let's take a look at a real-life example of a chart. So here we have a snapshot of a chart for a patient named Fuzzy XV Alidocious, and this is from Epic. He is a 5-year-old male with Down syndrome and diabetes. We're going to see him for PT after he broke his arm when playing with his brothers. So we can see that Fuzzy is allergic to NSAIDs, cats, and nuts. So no cat therapy or peanut M&Ms for Fuzzy. We can also see that Fuzzy is on a lot of medication, so we'll need to be mindful of any possible side effects he might have. We can see that insulin is something that he needs because he is diabetic. So we mentioned before about looking at blood glucose levels and seeing whether they are too high or too low, which may tell us whether or not Fuzzy will be able to tolerate exercise on that day. Obviously, there isn't much you can see from the snapshot that we have, and due to HIPAA, we can't show you the rest of his chart, but looking at the patient's snapshot or chart summary would be a good place to start when doing chart reviews. Military time. So military time all started with the early Egyptians, who were the first to use a 24-hour time system. Today, it's commonly used in the military, which is why it's called military time. It was invented so that people would not confuse 12 o'clock midnight with 12 o'clock noon. In areas that perform highly sensitive tasks, such as intensive care units and hospitals, use military time to administer treatments. Otherwise, a mistake in drug administration can result in a patient's death. So how to read military time. So you start at midnight, and so you count from 0000 over to 2400. So midnight would be the 0000, noon would be 1200, and then 11 p.m. would be 2300. Basically, after 12 o'clock noon, you just add numbers. And times are all read in hundreds, and all zeros must be read. So 0600 is 0600, which translates to 6 o'clock a.m. 1400 is 1400 and translates to 2 o'clock p.m. 2000 is 2000 and translates to 8 o'clock p.m. So this concludes our presentation. I hope you all now feel much more confident with reviewing charts and reading military time. Peace and love, Lydia, Anna, and Jess.